All right, thanks, Gil. Even in this pandemic, health professionals want to educate us about other conditions they are still treating. And this is Atrial Fibrillation, or Afib Awareness Month. Joining us to talk about that is Dr. Anish Tolat, cardiac electrophysiologist and director of VT Ablation with Hartford Healthcare Heart and Vascular Institute. Doctor, welcome.
Thank you. Thanks for having me.
Oh, our pleasure. First, tell us, what is atrial fibrillation, Afib?
So atrial fibrillation is an irregular heartbeat that originates from the upper chambers of the heart, the atria, and it basically causes a loss of mechanical contraction, and essentially the atria start to quiver, and they don't beat normally.
How common is it?
Afib is actually very common. So in fact, there are studies showing that above age 40, the risk of developing Afib is 1 in 4. So many of the people you know probably have Afib.
Wow, I had no idea. All right, tell us about some of the symptoms of Afib.
So atrial fibrillation can often be associated with irregular heart beating, palpitations, lightheadedness, sometimes chest pressure, shortness of breath, and just sometimes fatigue.
And tell us about some treatment options if someone is diagnosed with Afib.
So there are a few different treatment options. Some of them include medications to slow down the heart rate. Afib often is associated with a rapid heartbeat. Other medication options are used to control the rhythm electrically. And there are some catheter ablation options as well.
All right, what happens if someone has this and it goes untreated?
So if patients have it and it goes untreated, there are several things that can happen. Sometimes patients can develop what's known as tachycardia-related cardiomyopathy, where the heart starts to beat fast all the time for weeks, and they develop congestive heart failure. Other potential options in terms of strokes, so some people may develop a stroke if they don't get treated properly, and Afib tends to become a more permanent condition.
All right, and doctor, tell us about something called cryoablation. How does that work? What is that?
Yeah, cryoablation actually is a relatively new technology that we're using, including here at Hartford Healthcare. And it basically involves freezing tissue instead of heating it to destroy the tissue that's abnormal. So we're using a balloon inside the heart, and we have liquid nitrogen flowing through the balloon, and that allows us to treat the rhythm condition.
All right, how long does that procedure take?
So the procedure can be anywhere from 2 to 3 hours at the hospital.
All right, Dr. Anish Tolat, thank you very much for bringing us up to date on the latest on Afib, how common it is, and some new treatment options. We appreciate your time.